All right, hi, Dr. Ben Newman. I'm a coronavirologist. Yeah, there are a lot of people that say that, but not so many that have actually, showed up for the meetings and stuff like that. So, yeah, here we go. This is where I answer your questions. Next question is from Dean, and it's down the screen a little bit. There we go. I have a family member who is allergic to PEG, polyethylene glycol, and polysorbate. Oh, that's unfortunate. Yeah. Which are present in the J&J, Moderna, and Pfizer vaccines, but not all together. I believe Moderna and Pfizer are both what they call pegylated lipids they have in there, which is they mix it up in a little lipid ball, your messenger RNA, and there is polyethylene glycol on the outside of some of those lipids. So those have that, and then polysorbate is included in the Johnson & Johnson and also the AstraZeneca if you were thinking about going to another country. Yeah, so what do you do if you're allergic to these things? Well, all right, there are a couple things I would say. If it's a self-diagnosed allergy, I remember there was a paper a couple years ago, and I'm not Googling the right words to find it, but it was out of the UK, and it showed that 5 out of 6 self-diagnosed food allergies were unable to be confirmed by any sort of laboratory testing. So it was things that people were misattributing. Now, if you've actually got a skin test and the skin test erupted or something like that, then I would say you need to stay on the safe side. And I would say a mask is going to be this person's vaccine, and they're going to wear it all the time. Because with a vaccine, you wear it on the inside of yourself, and you don't have to wear the thing on the outside. But yeah. But if you're, I don't know, flexible, there are 3 vaccines that do not have any polyethylene glycol or polysorbate, as far as I am aware. At least none is listed on the ingredient lists and in a couple of papers I checked. And those are actually the 3 Chinese vaccines. You got your Sinopharm, your Sinovac, and your CanSino. If I remember right, Sinopharm and Sinovac, yeah, I got that right, are both inactivated virus vaccines. They just grow the virus and inactivate it, and then there it is. They also don't work very well. These are the ones that have been pulled from a couple of clinical trials because they were working at nearly 50% effectiveness, but it wasn't any higher than that. And that's where we've drawn the arbitrary line where we say, yeah, it's not really worth it. The other one, though, the CanSino, and that's the company name, and they have a different name for the vaccine. That one is approved in Mexico for emergency use, so that one's fairly close. Each of these other vaccines is approved in various countries. It tends to be in South America and Asia. And the WHO has approved at least 2 of those and maybe 3 of those vaccines, meaning that theoretically, if a country wants to, there is a mechanism that would allow them to have it there for emergency use authorization use. So, yeah. Fancy a trip to Mexico? I don't even know if you can just go to Mexico and show up and get the vaccine. It may be layers and layers more complicated than that. But yeah, that's the story as it is right now. Now, I do not know about the, let's see, GlaxoSmithKline, Sanofi, and I think it's manufactured by Fujifilm, of all people, vaccine, which is a protein-based vaccine. I am not sure whether that is going to have any of these components in it. So that would potentially be something that we could look at later when it's actually through phase 3 clinical trials. I believe those have started, but they have not finished. They're running kind of a year behind some of the other countries that were, or other companies that were making vaccines. So there you go. That's all I know about that. And I don't know. The question goes on. It mentions, should I risk an allergic reaction? I guess that's an option, but that would be a talk to your doctor first. And if you're going to do it, you would want to do it in the doctor's office with somebody with an EpiPen standing by. There are allergic reactions that people would call an allergic reaction that would not be a severe allergic reaction. And it's only the severe ones, basically anaphylaxis, where everything swells up and you can't breathe, that would be what they would want to watch for. And an EpiPen is normally what would be used against that. That's not something that I could or would recommend. Yeah, that's very much talk to your doctor and weigh the pros and cons. And yeah, that may be an option. And the other options are the Chinese vaccines, which you can't get those in the US. But if you're somewhere else and I have no idea where you're writing from, then there's a chance you can get them where you are. So there you go. Yeah, that's as much clarity as we can provide on a rather murky issue. And yeah, I just hope that everything goes all right for this family member with their allergies. And one way or another, if that person can't be vaccinated, that's all the more reason to get everybody around them that can be vaccinated as soon as you can. Because you are going to be part of the shield that protects this other person. There you go. All right. Thanks very much. This has been Ask Dr. Ben.